Hey, it's Chris Bowling.
Hey, it's Chris Beyer.
Mr. Buyer, a very good client of mine, sent me a article, and it was a survey of the largest
Yes.
employers out there. What did they experience in 2023, and what are they concerned about? We believe that it doesn't matter if you're a large employer, a small employer, if you're self-funded, and you have the ability to address these concerns because you've got more flexibility.
Right.
We thought that it would be a great topic. We're actually going to make this a two-weeker.
Yes. Two
We're
parts. Two parts.
two parts. We're going to cover the first four in this episode, and then we're going to cover the next four. But I found them fascinating. The first one, the number one thing that they're dealing with, this blew my mind: mental health.
Yes. Yes. Still on the rise. And this survey was, like you said, large employers, mega employers, right? But it was the
Yeah.
business group on health that put this together. And so as we're looking at all of that, mental health challenges remain on the rise and are the top areas of prolonged impact, still resulting from the pandemic, is what it says. So I think we've talked about this a lot. Are you adding mental health support, mental health resources, or services to your benefit program? Not just the standard EAP, but additional services. I think that's got to continue to be a focus for employer groups, especially if that continues to be a long-standing concern after the pandemic.
And I reached out to our local provider who you and I had met, pretty new to the community.
Yeah.
And he said his backlog was still 8 to 12 weeks out. So
Yes.
one of the things we've done to combat that is make sure you're adding mental health to your telehealth
Yes.
option, because
Yes.
if you can at least start to have a conversation with somebody, it's better than not being able to have a conversation with somebody for 12 weeks. So
Yeah. And we continue to hear that, not just local, but across the country, that the ability to schedule with a provider, even if they're in an EAP program, they just don't have capacity. And if it's, like you said, adding on to the telemedicine or buying a standalone virtual option, that is continuing to be a way to help impact the mental health concerns.
yes. So number two is near and dear to my heart. I think I've spent the last 7 years. It's funny, Blake, who I'm sure you guys have seen on our thing, asked me yesterday, so what do you really specialize in? And I was like, well, Blake, if I had to narrow it down, pharmacy is probably where I've
Yes.
spent the most effort in the last 7 years. Number two on the list, pharmacy costs are still killing them. So
Yes. I
we
said
got
92% of the employers are concerned or very concerned about high cost drugs, not only on the plan, but in the pipeline. What is coming in 24 that is new, that is extremely high cost. So I know, Chris, you love helping to fix this problem for employers.
yes, let's talk about two scenarios. Chris, you have a nonprofit who
Hmm.
in the last, what, 4 months have seen more specialty meds being prescribed than they probably have in the last 2 years. It's
Yes.
just killing their health plans.
Yes.
But
Yes.
thank goodness we've got a great PBM that's finding resources on how to source that, how to get that at a much lower cost.
I
Uh,
would say that's continued to be, a win, being able to source internationally, source through other various methods through the PBM programs. But it's still one of those situations that we get a significant savings the first year or two, and now we're back to a lower baseline. It's going to continue to creep up as new drugs come on the market. I mean, you're exactly right. They saw 60-70% reduction in that second year when we put these plans in place, but now it's starting to creep up because new stuff is hitting the market. Do you found another resource though? Because there's a
oh,
lot of our employer groups that say I can't go find an independent PBM. I can't carve that out because I'm in an ASO agreement. I have one option because of my size, but I'm self-funded. So what have you been able to look at, Chris?
man, there's an organization I ran across that's in the state of Iowa, pretty close to us, and where he has found a tremendous opportunity for his business is he will look at your entire drug spend, and he will go through and run a analysis and determine what drugs can I save you money on.
Yeah,
And then he will just become that mail service for those drugs. So
right.
you and I have got a great opportunity for a very large company, and we just looked at their top 30 drugs,
Hmm.
and about nine of those we need some more information.
Yeah, we
But
just had the list. Yeah,
yeah, so yeah, there was about 21 of them that we had enough information that he could run this analysis.
yeah.
9 of those drugs, he could save that organization $315,000 on just 9 of them. The
Yeah.
other part of that, we just need more information. But
Yeah, that's significant. And, that's it's just being smarter and not relying on what is just being done through the normal PBM or the normal channel, because, this is on top of potentially some other savings that could come through. So I like that. I think that's going to continue to be a focus for all of our clients, but employers need to be thinking about that in 24.
agree.
What's the third one?
Third one was employers are evaluating their partners. And I
Yes.
don't mean just us as consultants. We were only 5% of the employers are actually considering removing their current consultant. A lot of them were in health and well-being vendors.
Right.
I
Right.
think of wellness, I think of maybe Point Solutions, maybe it's a diabetic program,
Yeah.
and they're struggling to say what's the ROI behind this. And you know what? There are some more innovative companies that have come out, and we've got to start looking at ways to control our cost, and we don't believe that these vendors are doing what they
Yeah.
promised us. So
Yeah, you and I've even had that just from our clients here coming into the new year in the fourth quarter, as we've been going through renewals and talking about 2024. Just, is there a better option? Is there a better option? I feel like we are evaluating those solutions more than we ever have on behalf of our clients. So that's interesting. It continues with the large employers too.
number 4 is cancer. Of
Mm,
course, you look at your top 5 claimants, guarantee at least one of them is cancer, if
yeah.
not 50% of them. And again, this is an area where there are some great options.
Yes.
We have a program called Assured Excellence, right? Where we've gone out and we've done the research of the top hospitals dealing with very specific cancers.
Right.
Say, you know
And
what?
how to get the
Yeah,
right care at the right price, and not overspend, not undertreat. I mean, there's so many different components to go through with that.
yeah, just go to the best of the best, right? Because it's
Yeah.
all going to cost about the same. So
Yeah.
let's make sure that you're not going to an organization or a health system that, yeah, they treat that kinda.
Yeah.
Let's go to the ones that treat it all the time,
Well, it was half of those employers are looking at a center of excellence style approach, it says, and then also working on different biomarker testing. So how are we preparing people who have a higher, I guess, opportunity is a bad word, higher concern of cancer because of their genetics, and offering that as a solution for them in terms of benefits. But yes, I mean, there was a ton of other things that were causing costs, but cancer, top of the top, all 3 years of this survey as they were looking at it. And, that's impacting a lot of people. And it's not just the cost necessarily, but that employee is down and out.
Mm.
They're not just working, part-time. They're fully in recovery mode if they're fighting that. So it's not like you lose the productivity from that employee too, not just the fact that they're going through the cost aspect of it.
Yeah, impacts the entire family. It's not
Yeah.
just your employee, it's that employee's, significant other now
Yeah.
also can't work as much. It's such a huge financial impact to that family. But yeah, I think going back to biomarkers, you and I have looked at 3 different companies.
Yes.
They're fascinating. I mean, what they can determine if you've got this gene, then you've got a higher risk of this
Hmm.
cancer. A lot of exciting stuff out there. But hey, that's the first 4, right?
So,
So
yeah, mental health, pharmacy, vendor relationships, and how to prepare and fight against cancer as a cost driver. So I'm looking forward to next week. We'll talk about the next 5.
thank you, Chris.
All right. Thanks, CB.